Hi, back again. You remember I was the one that did the video, the first part, a very brief part, because I'm still trying to figure out how to work this video system about what happened to me at Mount Sinai Hospital, and that happened to me in the emergency room of March 9th through 10th of 2018, and a very horrible experience. The reason why I was there, I was rushed by ambulance by doctor's orders. When I was able to get myself to City MD, the doctor took one look at me, right away called the ambulance. 2 blocks away, $1,600 in ambulance fees later, I ended up in the emergency ward at Mount Sinai Hospital. Unable to breathe, very difficult breathing, bleeding internally, I later found out. That was the fluid sitting on top of my lungs, and that's why it was so difficult for me to breathe. Intense stomach, knife-like, sharp pains in my stomach. Didn't know what was going on. Couldn't move my torso. I couldn't do anything. I thought I was going to die. So I was so upset. And they immediately they hooked me up with IV. I believe that was morphine that was going through my veins. And I had a CAT scan and everything. And as soon as I was stabilized, the morphine flowing, but I still couldn't move anything. Nurse Roseanne Toth, as I was told through my discharge papers. Roseanne Toth, you can see it right there. She said that she needed to remove my watch for needles that she needed because they were putting needles in me everywhere. And it was a very expensive Rolex platinum and diamond watch, which I bought in 2004. I showed you the sales receipt, the guarantee from Rolex, and also a letter from Rolex confirming it was my watch, confirming the price. I showed you documents also from the inflation rate and the fact that it had gone up, so that in 2019, the value of the watch, if you could find it on the market, and that's a big if because I haven't been able to find it anywhere on the internet, and called many jewelers and they can't find it. It's a collector's item. But if you could find it and you could buy it today, it would just be shy of $70,000 with local taxes. So this has been confirmed by Rolex in Geneva and in the United States. And it's been confirmed by jewelers as well as associations in the luxury watch field that have said that Rolexes just don't depreciate in value. They go up. So there you have it. Now, as I said earlier, my watch was taken from me by the nurse, and I immediately asked the hospital to call the police, to call the security, to call the nurse supervisor because I knew I had been robbed. Once the nurse told me when I asked her where was my watch, she said she put it in the bag. What bag? Well, the bag underneath my bed. And of course, I looked everywhere. Not there. But frantic for my watch. I just wanted my watch back. I kept telling her, please give me my watch. Please give me my watch. She told me she put it in my coin purse inside my wallet. So first of all, why is a nurse going inside my wallet, inside my coin purse? But of course I looked anyway, and of course it wasn't there. So I'm waiting for the police to come, and she says, here's some bacon and eggs to eat for breakfast. Now, why would you give that to someone who came in with knife-like pains in their stomach, told to immediately get herself to a gastroenterologist to find out what's going on, for him to explain to her what was going on, because they suspected it was stage 4 cancer, pancreatic cancer. They didn't want to tell me that at the time because they didn't want to scare me even more. After I'd been through all those tests and that blood work and everything, and she had taken my watch from me, saying she needed it for needles, and I just didn't know what was going on. And she's telling me she's giving me bacon and eggs to eat. And she told me to leave the hospital at 4 a.m. in the morning, which I couldn't because I couldn't move out of that bed. So that said, that's what happened. And by the time the police came, she was already gone. The hospital didn't detain her. The nurse supervisor never came. The security director never came to see what was going on. She just left. Her shift was over. And she casually said, well, the hospital, don't worry, the hospital will take care of you. So I looked at her, what did she mean by that? Well, it turned out what she meant was that the hospital insurers will take care of it. Don't worry, you'll get your money, okay? Strange thing. I just wanted my watch back. So the police arrived. They had no one to question. Several weeks later, and after securing a subpoena, they had to go to the court to get because the hospital wouldn't let them on the premises to talk to anybody before then, of course, the whole scene had been sanitized. Now, what had happened? Well, the lawyers, the legal department there, Beth Essick is the general counsel, had sanitized the place, basically had told everybody what to say, what not to say to the police, and how to say it. So, when the report finally does come out by the New York City police detective, Devodian, who was assigned to the case, it read, and here it is, the report. The security director believes that hospital staff may have mishandled the crime victim's property, causing it to be lost. Can't find anything here because it has to be without a reasonable doubt. So it must be a civil matter. Let her sue the hospital. Which, of course, will cost me a lot of money and a lot of time and a lot of aggravation. And they will appeal and appeal and appeal. So years later, maybe I'll get a little something from them. So, and I just wanted answers. No one would answer what had happened to me at that hospital. So there you have it. Carefully worded legalese, obviously, from the hospital. So now it's time for me to hear from their insurer, which pretends like, I left my watch somewhere in the nightstand. I just forgot to pick it up when I was getting ready to leave, and I just don't know where I put my watch. Not that it was taken from me, okay, but I left it somewhere. And they asked me to sign a settlement. And for my $70,000 Rolex watch, which is no longer available on the market, is now a collector's item, we'll give you $25,000 for it. Oh, and by the way, sign all these papers releasing the hospital of all liability whatsoever, that you'll never sue them, you'll never, you'll forget about the fact that, maybe it was caused, that whole incident was caused by the hospital. Oh, and by the way, the reason why the police couldn't find anything, because HIPAA requirements, there are no cameras around the bed. So if anybody's ever worked in retail, if anybody ever worked in a shop, anybody ever worked anywhere where there was security cameras, I guarantee you, the employees, they know where those cameras are. So if anything that goes down in that place, they know to avoid those cameras. And I have a pretty good feeling Nurse Toth knew that. And that's why she took my watch when she did and where she did. So nothing happens there. And I'm beginning to wonder, why is it this hospital wants me to sign all these papers about vicarious liability that I won't hold the hospital responsible for, any alleged acts or omissions of the hospital? Sounds strange to me. And then I got to thinking, well, why would an insurer be involved when the hospital simply let this woman go? She was not able to be questioned by the police, and everybody knows you're most likely to tell the truth, or they can tell when you're lying, when you question right after the incident takes place, an authority figure. And of course, that didn't happen. And, well, it seems to me they should have inventoried my stuff. If they were taking my personal belongings, especially my valuables, someone should have signed for it and put it in a safe. And that didn't happen. In the heat of the moment, when I was afraid for my life, when I thought I was dying, and I just wanted that horrible, horrible pain to go away, she claimed she needed it for needles. I believed her. She was my nurse. She was my caregiver. She was a person that the hospital's emergency room had put in charge of my well-being. So I believe she had done the right thing, and was just shocked and appalled and still in a lot of pain the next morning when I found out my watch was gone. So now time for me to find out about this Nurse Toth. But I'll come back to that in a minute. First of all, I want to get answers from the hospital. What happened? Please tell me, is anybody looking into what happened to my watch? Will I ever get my watch back? Can you compensate me for it if you don't get it back? Please make the situation right. Do the right thing. So I write 3 letters to the hospital. I write one, July 26th, one, August 2nd, and one, October 15th, as you can see. No reply. So who are these people at the hospital, and who did I write to? Well, the first person I wrote to was Beth Essick, who's the general counsel, and the second person was Kenneth Davis, who is the CEO, the president of the hospital. No reply. I wrote to Tony James, who's a member on the board of the trustees. No reply. I wrote to Joseph Fennessy, another board member of the trustees of the hospital. No reply. I wrote to Mr. Edward Sunshine. No reply. I wrote to Stephen Hochberg. No reply. And who are all these people? Okay, well, Mr. Hochberg, I have to tell you, he's a member of the board of trustees, but he's also at Solar Capital. I think they're a private equity investor group, and they specialize. He's also a partner at Deerfield Management, who specializes in healthcare investments. So they're making a lot of money. So I wonder if that's very helpful for him to be on the board of trustees at Mount Sinai Hospital. And I want to find out about who is Mount Sinai Hospital. Well, they like to say this word a lot, vision. They're all visionaries there at that hospital. Exceptional team. They say that they give exceptional patient care. They say that they give compassionate patient care. So I'm hoping for a little bit of that compassion. Maybe somebody could respond to my question, where is my watch? Please explain to me, what are you doing to investigate as to what happened to my watch? Where is my watch? Please help me. No reply. My watch has been missing. I've been without my property, without any answers, without anything for over 18 months now. That happened in March 2018. No reply. Here's our friend Kenneth Davis. There he is right there. You can see him. I'm not good with the video, but you can see right there he is. Right there. Peter May next to him. I thought he would be helpful. He seems to be in the arts, connected with Lincoln Center, New York Philharmonic. You know, I'm a musician myself, so I thought that would be very interesting. Didn't help. Beth Essick again, our trustee general counsel. And here we go on and on. And here's a very interesting guy here, Arthur Klein, on the board of trustees. Now, why is he interested? Because he served or has served on the board of trustees of the Sackler School of Medicine. Sackler. Now, where have we heard that name before? Try OxyContin, try opioids, try more than 2,000 lawsuits against them for all those people that died because of OxyContin and those drugs they were pushing. So, Mount Sinai partner. Bright Health. You can see them everywhere in the New York public transportation system, as well as Mount Sinai advertising everywhere. Well, they say here that their partners are also with Medicare and Medicaid. Where have we heard about that? Well, your tax dollars at work. Let's put it like that. So I guess it must be very profitable for Mount Sinai Hospital to be partners with them. So remember, compassionate patient care. Mr. Kenneth Davis, what do we know about him? Well, from here online, we see right away, he is that favorite word of theirs, a visionary. And he has a profile on Forbes magazine. Now, Forbes, that's interesting, a nonprofit organization. Aren't they about money, big money? Well, it seems that he is responsible for $8 billion in revenue that hospital took in 2013. Visionary leader, he calls himself, okay, who has guided the institution on a strong and dramatic growth trajectory. One of the largest financial turnarounds in academic medicine. $1.6 billion he's raised for the company. Really interesting. So I think they should have time to investigate my claim here. Compassionate care, someone who thinks they're dying, and I'm not alone. That's what the emergency room is for. People who are in crisis in terms of their health, between life and death. Okay. In 2017, Wikipedia page, $12.5 million almost this guy made as a base salary. Now, just to put this in perspective, and you can find that information on ProPublica, the tax returns will verify that for the hospital. Mary Barra, by comparison, a for-profit organization, General Motors, you heard about General Motors, the big car manufacturer, her base salary was $2.1 million in 2018. Now let's compare that in 2017 to this nonprofit charitable organization. 2017 salary, almost $5 million. There's a problem here. Okay, so, and that's just the base salary. So I know that Ms. Barra made much more money when you look at the whole compensation package. So I can only assume Mr. Davis was in the same situation. Joseph Hennessy. Board of Trustees. I wrote him. No reply whatsoever. No reply. Sorry, I'm not very good with the camera, but there you have it. Okay. South Nassau Communities Hospital merged with them. Big business, big money. Edward Sunshine. Now that's an interesting guy. I'm going to come back to him in a minute. But what you need to know about him, head of a big real estate investment trust, the biggest one in Canada. They manage over 350 retail properties, over 50 shopping centers in the United States, 80 million square feet. He's also a director of Royal Bank of Canada. And also he was named in 2013 as Canada's Outstanding Chief Executive Officer of the Year. Very interesting guy. Tony James Blackstone. He's another director on the board of trustees of Mount Sinai Hospital.
Yeah, Dad, I gotta call
I
you
wrote
back
to him.
in a couple minutes.
Nothing.
Okay?
No reply whatsoever.
Listen,
Okay. He's chairman of the finance
Thanks for the
committee at Mount
Chinese
Sinai
food.
Hospital.
Very
So I
good.
guess he keeps hold of the
You
money.
like the raisin
What's going
bread?
on there? And then we have Peter May.
All right,
But
well,
Peter
I'm gonna
May,
call you back
chairman
in a little while.
emeritus. That's our music guy I told you about, with arts
Now,
and so
call
forth.
me tomorrow
No
morning.
reply. So you have to wonder what's
Yeah.
going on over there. Why don't they
All right.
reply?
I'll call
They
you back
seem to be
shortly.
very interested in compassion, but they show no compassion to the patients. And yet, I asked them very nicely, please explain to me what happened. I'm just this poor woman is wondering who can help her, who can give her some answers about her watch, about her property that was taken from her and just disappeared. Was looking for answers as to why no one was questioned at the hospital when the police arrived, why they allowed that nurse to leave before they arrived. Who is this nurse Tough? Very quickly, 0.34 seconds, Google search, right away, Nurse Toth. There she is. Only one, okay? And she's been licensed in Florida, Connecticut, Massachusetts, North Carolina, Ontario, Canada, and in New York. So it's got to be the same person. Well, I see lots of places license has been suspended, notably in Florida. Suspended license, suspended license, suspended license. Connecticut, expired license. Massachusetts, expired license. North Carolina, expired. Why is she moving around like that? What's going on here? Well, let's keep moving. First thing I find out, state of Florida, State Surgeon General in 2010 has issued an order of emergency suspension, okay, for Roseanne Toth, because they have found her to be an immediate and serious danger to the public health, safety, and welfare. Voila. So you have to wonder why they had to suspend her license, but they said there was no other method available to adequately protect the public. So what happened with that? Well, I've got lots of paperwork to show you. Administrative complaint, order of emergency suspension of license. But the short answer to that question was found here in a proceeding that took place less than 6 months before my watch was stolen in March of 2018. So this came down, the hearing was on January 30th of 2017. Less than 6 months? Okay. So less than a year. Let's put it like that. Okay? Well, a little bit more than a year, I guess, because mine was March 18th. So we're talking about 15 months. Okay? What happened there? Not even that. 14 months, maybe. Well, it turns out she had a cocaine problem. That's what was going on in Florida. And she didn't hang around to fully rehabilitate herself. She never straightened that out. That's what went down in Florida. On top of that, she had a habit of not telling the truth or just being quiet and misleading people like the way she did me. So that's where she was getting around, that no one found out her license had been suspended. No one found out that she had that drug problem of cocaine. And also, here's the kicker here. She was actually a criminal in Canada. And that was the straw, the needle that, or the straw that broke the camel's back. She was found to be operating a vessel while legally drunk and endangering the lives of others, the passengers on the boat, which they say she owned. So that, first of all, I'm very interesting to find out she owned a boat. Boats are very expensive. Well, maybe she inherited or something like that. I don't know. But you have to wonder about somebody who purposely takes your Rolex watch, owns a boat, obviously has a cocaine problem, has a problem of telling people the truth or disclosing who she really is, and also has been criminally convicted for public drunkenness and endangering the lives of others. And the state of Florida has come out and said that she shouldn't be working as a nurse. So I'm wondering all this. She's been called, how can we say? They have said here, not only did she endanger the lives of others, but she's been found guilty of a criminal offense. They suspended her license. They've tried to put her through programs which she didn't do, wide-ranging programs, and she's been impaired voting, non-reporting of proceedings against a member, and a finding of professional misconduct, providing inaccurate information. Really interesting. Well, guess what they say about her? Basically, they said that, well, doesn't make the nursing profession look good. Let's put it like that. That's a nice way to end that story about nurse talk. So you have to wonder, New York State, why they didn't discover that. Well, first of all, New York State has a record of not being very helpful in terms of the oversight of nurses. Article from ProPublica, weak oversight lets dangerous nurses work in New York. New York lawmakers race to toughen oversight of nurses and other professionals. State audit slams New York's oversight of nurses. So before I move on and talk about this situation with this hospital, okay, and why we've got a serious problem here, let's think about the fact that at $50,000, at $70,000, we're talking felony. We're talking jail time if you're convicted of stealing at that level. And let's talk about the fact that many questions to be answered here. But number one, let's see, I have those questions here. Here we go. Number one, why was this person working in an emergency ward of a hospital? Number two, where people are suffering, possibly dying, in critical condition, and in no position to defend themselves, and most of the time not even really aware of what's going on because the pain is so intense, and you have somebody that's been found to have a drug problem, cocaine. Oh my goodness, is taking care of that person? I guess I should count myself as being lucky to be alive the next day.
So just so that
and still have my other jewelry
you guys
with me.
aware, make an announcement of when the clock strikes 12, this table will be closed. Okay?
Second of all, why didn't the hospital? But she did take my most valuable watch, and the one that's most likely to get money on the street, my Rolex, my diamond and platinum Rolex watch. So why didn't the hospital secure and lock in its safe my personal belongings? The first thing the hospital security director said when I went to see him after the police left, because I had nobody else to talk to. I had talked to her supervisor, who, by the way, was a per diem worker. She was very nice, but she didn't know what to do because she had no authority at that hospital and had no idea what was going on. She just heard my watch had gone missing, okay, and that the watch had been taken from me by that nurse, and that she had left before the police arrived, and nobody detained her. Why didn't the hospital secure my watch in the safe? Big safe in the security director's office. So why didn't that take place? And number three, why was a nurse detained by the hospital for questioning by the police when they arrived? And why wasn't the police allowed to even touch her or even talk to her until after she had been coached by the legal department as to what to say, what not to say, and how to best protect the hospital? What about me, the victim? What about Medicaid and Medicare that pays all that money to the hospital? What about the many, many people come there that are helpless, scared to death they might die? And number four, everybody's wondering this. Don't they do background checks there? So that's my story. This is what happened at that hospital. I would expect Mr. Sunshine, who I told you about earlier, from Canada, voted Businessman of the Year or something like that. I think that's what they called him. Shouldn't he have alerted to the hospital? Well, maybe they're on to something in Canada where they talk about socialized medicine, where medicine is much cheaper, where people don't have to worry about going to the hospital and getting bankrupt because of it. They don't have to worry about a $1,600 ambulance bill to take them 2 blocks. I mean, $8 billion in revenue, $12 million base salary to the CEO. All those people, hedge funds, private equity investors and so forth, healthcare investors on the board of trustees. And nobody thought to do a background check on this person? Interesting. I wonder if they would do the same if it were one of them or one of their relatives, or their mother or their father, God forbid. So I'm still waiting for answers. This is my story. I've been harassed by the insurance company. Well, just sign. We don't understand. That's enough. $15,000. That's enough. $25,000. That's enough. And by the way, when you do sign and they find your watch, we get it because we paid for it. Well, that's a really good bargain price for a very expensive watch. And what about me? I didn't bargain for that. I thought I was dying. I was in intense pain. I could not breathe. I needed the help of healthcare professionals. I didn't go there to get my watch stolen. I didn't go there for this aggravation, it's grief. I went through several months seeing specialists who finally told me I had a bacteria and virus sitting on my pancreas. That was causing the problem. I didn't have cancer, thank God for that. But here we are more than 18 months later. Hospitals still won't come to the phone. They won't answer my letters. The trustees, they don't care. They don't answer. And the insurance company says, never happened. So where is the justice? This is my story of what happened to me in Mount Sinai Hospital in New York City. Thank you. Goodbye. So do I hit a red? Close? Stop? Or should I